So welcome to my channel. Myself Dr. Paramita De, Professor of Bengal School of Technology. Today I am going to teach you Industrial Pharmacy and the name of the chapter is Parenteral Liquid Preparation. So first the definition. So what is parenteral preparation? They are the sterile preparations containing one or more active ingredients intended for administration by injection, infusion or implantation into the body. That means whatever injectables we use, they must be sterile in nature. That is, they should be free from microorganisms. The formulation of injectables involves a very careful consideration of many factors like the route of administration, the volume of injection that has to be given to the patient's body, the vehicle we use in the preparation of the dosage form, the need of preservative, the osmotic pressure of solution, the hydrogen ion concentration of the solution. Today, I will discuss in details about the route of administration. So, the different route of parenteral drug administration are the intracutaneous or intradermal injections, subcutaneous or hypodermic routes, intramuscular, intravenous, intraarterial, intracardiac, intrathecal, intracisternal, and finally intraarticular. So, these are some of the important routes of parenteral drug administration. So let us discuss one by one. So this is a diagram of the different parts or the layers of skin. They are the muscle, the subcutaneous layer, the dermis, the epidermis, from the inside to the outside. And within the muscle and the subcutaneous tissues, the veins are passed through them. So we can see from the diagram that when the needle goes to the muscle section, we call it as the intramuscular route. When it penetrates up to the subcutaneous section of the skin, we call it as subcutaneous administration. Similarly, when it is penetrated into the veins, that means into the blood circulation directly, we call it as intravenous, and then the intradermal. So it is very important to know that what type of volume should be given by which route. So for intradermal, the volume is very small. It is 0.01 to 0.02 ml only. The route is used mainly for the diagnostic purpose in the investigation of immunity and allergy. So this layer we can see from intradermal that this will be given to the dermis section of the skin. Okay. So this volume you have to be remembered very much, because this type of question comes in your short MCQ questions or in the GPAT type questions also, that what is the volume of intradermal injection. So you have to keep this volume in your mind. Okay. Then it is followed by the subcutaneous or the hypodermic injections, and the volume here is about 1 ml or less. These are made under the skin into the subcutaneous tissue, and it is one of the most popular route of administration of parenteral products. One thing is that through this subcutaneous route, we have to take much precaution, as we cannot inject the oily suspension through this route, because it will cause pain and irritation if we inject the oily suspension in the subcutaneous layer, because blockage of small blood vessels may take place. So this has to be taken under consideration. Sometimes question comes then by which route we will administer this oily suspension. Oily suspension is administered through the intramuscular route only. Intramuscular means that is directly into the muscle. Okay, so the needle passes through all the layers of the skin and goes to the muscle. Which muscle it is used? The shoulder, thigh, buttock, etc. And the volume ranges between 4 ml, but it should not exceed 4 ml. And it ranges between 2 ml to 4 ml, but should not exceed 4 ml. Here, muscle can withstand the pain of the oily preparation. So, muscle or intramuscular route is the route of choice for administration of this oily suspension into the human body. Next comes a very important route, that is the intravenous route. That means the drug is administered directly into the bloodstream, and here the volume ranges with a high range, 1 ml to up to 500 ml. So when the volume is small, we call it as SVP, that is small volume parenterals, and when the volume is large, we call it as large volume parenterals. And these large volume parenterals are generally used when the patient's suffering from vomiting, diarrhea, electrolyte disbalance. We have to replenish very fast the electrolyte. We generally administer the drip or the saline solution, which is nothing but infusion, 500 ml of drip. Okay. This is another diagram I have collected from Google. This also reveals the different layers of the skin and how the needles get penetrated in each layer to give you different actions, faster action in the parenteral preparation. Next comes the intra-arterial. So intra-arterial means we have to administer it in different, it acts like a vasodilator. We directly administer it when it spasm comes, okay. When the arterial spasm occur, then we give this intra-arterial injection. Then comes intracardiac. Intracardiac means it is directly given into the heart muscle, okay. So heart muscle is generally get spasmed, or they are given in the cardiac arrest. Adrenaline, isoprenaline sulfate are used in this purpose. So directly this parenteral preparation is administered in the cardiac muscle. Then comes the intrathecal. So intrathecal means we will administer it into the subarachnoid space that surrounds the spinal cord. The patients in the back portion, that is in the spinal cord region, the volume we can administer 20 ml. Okay, so sometimes spinal anesthetics are given. Okay, during the C-section, during the birth of a child, okay, the pregnant mother is given a spinal anesthetic before her delivery of the baby. So amethocane hydrochloride is given as a intrathecal injection into the spinal cord. Sometimes antibiotics are also given in this route when the streptomycin sulfate is given for the treatment of tubercular meningitis. At the same time, this route is also used for the diagnosis purpose, like cerebrospinal fluid is used to diagnose whether there is any infection in the CSF or not. Okay. So you can see this diagram. The pregnant mother, she is given with a intrathecal injection in the spinal cord for the anesthesia purpose. Okay. Next is the intra-articular injection. This type of injection is made into the synovial fluid that is present in our joints, especially the knee joints. Okay. This synovial fluid is very important to lubricate our knee joint. Various kinds of anti-inflammatory drugs like hydrocortisone acetate is used or injected through this route to treat rheumatic arthritis. Okay, because in this rheumatism or arthritis, the patients suffer from pain. At the same time, inflammation also takes place. So for this reason, to get relief of this pain and inflammation, steroidal anti-inflammatory drugs are given, like hydrocortisone. They can be given either in the solution form or in the suspension form. So mind it, whenever we are giving the parenteral preparation into the knee joints, we call it as intra-articular, and whenever we are giving it in the spinal cord, we call it as intrathecal. So with this, I have come to an end of today's topic, that is different route of parenteral drug administration in the human body. Hope you have loved this video. It will surely help in your studies. If you like it, please give a comment, share my video and put a thumbs up. Thank you, viewers.